The Fujifilm Healthcare Forum, this is the third year in a row we've done it. And it's really an event where we try and get a broad collection of healthcare KOLs and key stakeholders within the healthcare industry and medtech together to discuss some of the key issues facing healthcare in the UK. Fujifilm then kind of supports and helps develop that conversation. And the benefit for Fujifilm is that we get to hear what's needed and some of the key issues that we need to work on in terms of innovation to address.
It's all about bringing the healthcare community together, from academia to industry to our clinical services and clinical leaders in the front line to really talk about the state of healthcare.
What I find really valuable about the event is the diversity of the panel speakers, the fact they're not just all drawn from a clinical background or an academic background. We're really getting sort of the whole view perspective on how we can do things differently.
So I think it's quite bold for an international company to host something like this that takes someone out of their day-to-day environment and enables them to discuss similar issues with similar people of common thought. And the outcomes that we have from this as well seem to then be seeing filtering through into the day-to-day conversations that we are having all throughout the year.
What really excites me is the honesty and the ability to self-criticize our system, which you don't see quite often. So I think that's where the transparency is really, really important. That willingness to have really, really difficult conversations and continue to have that.
What you need is these sort of spaces where there is trust. There's the ability to speak openly, to raise controversial ideas, to be confident that you can raise those controversial ideas. An exchange of ideas, an exchange of opinions from the top to the bottom. So, you know, commissioners, doctors, radiographers, technicians, patients, researchers, everybody bringing in ideas about how we can actually solve the problems, not just talking about the problems.
I think traditionally industry and the patient have always had this great big divide between them, and the NHS has been there that's managed that relationship. I think having something like this today where there's a patient voice and patient experience, it just reminds us who's at the end of that pathway.
The key thing today, you heard again and again and again, is that desire to improve healthcare in the UK, that desire to foster change, that desire to offer the best possible service. There's challenges, there is always challenges around resource and funding and staffing, but there is a keen desire in that room to do things better and do things well.
I think what's great about this kind of event is that people who work under enormous pressure in healthcare or in manufacturing or in health policy take a day out actually to make contact with one another and to really get exposure to aspects of healthcare practice and policy which aren't otherwise thought about, they don't get a chance to do. So I hope that that's really motivational for people when they go back to wherever it is they're working. They've got a new sense of purpose in what they want to do.
These sorts of events are designed so that Fujifilm can position itself as the #1 partner, medtech partner to the healthcare industry in the UK. And we do that through partnership, listening and engagement.
Ultimately, we're in this together. We've got only one NHS and we need to preserve that NHS, and that NHS can only survive when we all start talking.